is Melanie Browder. I am a nurse anesthetist. I got my bachelor's in nursing from Carlow University in 2010, and I got my doctorate and my master's in nurse anesthesia from Texas Christian University in 2015.
Terrific. So share with us what made you choose nursing as a profession.
I had an interview one time for my first job as an intern while I was still in nursing school, and kind of talked about where I came from. And I think the woman who I interviewed with kind of hit the nail on the head when she said that she thought that nursing had chose me. I grew up always feeling loved. I come from a big family. As a child, one of my first memories was my mom taking care of my great-grandma with Alzheimer's, who came to live with us. And my great-grandma, when she had Alzheimer's, she became very mean and very suspicious and just totally different, as the disease does to many people, unfortunately. And my mom, as time went on and the disease progressed, I'll never forget one morning I saw my mom sitting with my grandma, my great-grandma. She was butt naked, sitting on the bench. My mom had just given her a bath and was doing her hair and, helping her put earrings on. And she was, over 80 years old. And at that time, it was something I didn't understand. I couldn't understand why she would give care to this woman who was so mean to her. And she, she would regularly throw plates and cuss us kids out. And, she was incontinent. She had all these issues. And I couldn't understand how my mom could find that in her to spend the time, every morning getting her dressed and doing her hair for her. And it wasn't until years later, I was finishing up high school and needed to figure out what I wanted to do in college. And at that time, all I really knew I wanted to do was play basketball. And it so happened that the school that I got the biggest scholarship from was a nursing school. And I wanted to be a fashion design major, an art history major. And my mom, my family, my grandma, they were kind of like, just do nursing and see what happens. Maybe you'll like it. That you'll be able to get a job after school. So kind of begrudgingly, I went into it. I fell in love with chemistry. I took up a chemistry minor that I actually liked. I loved taking anatomy, and I loved playing basketball. And I was just kind of, not even really familiar with what I would be doing. After my sophomore season of basketball, I was home for spring break, working down at my dad's butcher shop with family, as I had done. I was 19 years old, so as I had done for 14 years before then. And I left to make a delivery for them, and a drunk driver hit me head on the highway. And next thing I knew, I woke up and I was in a different body. It felt like everything had stopped. Everything had changed in my life and turned on a dime. And suddenly it was like one of those things. I was, 19 years old, home for spring break. I had just started clinicals. I, wore scrubs for the first time just right before then, and did my first bed bath. And next thing I knew, I was waking up and there was lines and tubes coming out of everywhere, metal. And I didn't know what happened. I mean, it just literally was one of those things. I woke up on the other side, like, what in the world happened? And from then on, that experience that I saw, that, you know, that I got to have with my mom as a child, what I saw her do to someone that she really, I mean, of course it was her great grandma, but someone she didn't owe anything to, was what I started to receive from not only my family, you know, my sisters taking time out of their lives to pick glass out of my hair, or, I mean, my mom, she stopped her life in its tracks to take me to all my appointments and be in the hospital with me. And it made me realize that there's something that these people are giving me that I've seen, but I never understood. I never understood why I had been so blind to this. And one morning, 19 years old, I was finally in the rehab hospital. I had my jaw wired shut. I'd broken, you know, had skull fractures, jaw fractures, rib fractures. I had, my femur was shattered, my foot was shattered. I was in a wheelchair with a big external fixator from my hip all the way to my toes. Everything was so broken. The trauma surgeon, on the night that I came in, told my parents he was going to have to take my leg off. There was only one bone that hadn't been broken, but for some reason, you know, they decided to give me a shot. And even after that, he told me I wouldn't walk again. That basketball was definitely out of the picture, but that I wouldn't be able to walk. And just hearing this news and getting ready to go to physical therapy one morning, as I always had, and just figuring out, like, this is it happening to me? Why, you know, these people are just being nice to me. Like, you know, they're just being nice. This isn't happening. And sitting there in my bed, and next thing I knew, my stomach was rumbling, and my sweatpants, that by then were 3 sizes too big because I couldn't eat anything, just filled with the bowel movement. I had no control at 19 years old. And so I pressed my call button, and the nurse came in. I was so ashamed, and I just didn't. And she saw I was crying. I couldn't even lift my head up. And I felt so terrible I was so embarrassed, and the mess that I'd made for her. And she hugged me and she cried with me. And that was when I knew that something's happening here. This is the calling. You're giving me something you don't have to give me. Like, I'm at my lowest of low times, you know, and she came to my level without saying a word. No words were even needed, you know. And I started asking my sister to bring my schoolwork home from Carlo, because I didn't want to get behind in nursing school then. That became my motivation to get out of. I was staying at an inpatient you know, rehabilitation center at that time. That was my motivation to get out of there and to go back to nursing school. And specifically, all the while I was having surgeries, and because I had my jaw wired shut and the skull fractures, I had to be intubated awake through my nose with the fiber optic camera, and it happened to be the same anesthesia team every time. And they started to let me do it myself and help, because you know, it's the small town that I'm from, and I was like, I want to be on that side. This side isn't so much fun anymore. And so I knew that every single thing that had been put in front of me was so that I could find a way somehow to turn every single bridge that I've crossed into my life into a way to lift the burden a little bit, even for a second, like that nurse did for me that morning, for somebody else. So, yeah, my sister started bringing my schoolwork from Carlo, and I would sit in my bed with my jaw wired shut. I really, really wanted to go back to school in the fall, and I was still in a wheelchair. I wasn't supposed to be able to walk, but Mrs. Fickley, one of the faculty there who I keep in touch with to this day, my mom and I came in a wheelchair and wheeled me around, and I begged her. I said, please, Mrs. Fickley, I'm a 4.0 student. Let me in the nursing program. I promise you, like, you will not, I won't let you down. Like, I will make this work. You know, they had already made accommodations for me in the dorms and all of that. And she looked at me and she believed in me. She was the first person that was kind of like, okay, you can take the next step. This accident won't define you anymore. You're ready to turn it into something else. And here I am.
Wow, that is just such an amazing story. I mean, it just really touches my heart even. So you followed through with your dream then to become a nurse. And I guess tell me, and I understand now why you chose anesthesia kind of as your specialty in nursing, but share with us some of the patients that you feel that you may have touched and made a difference in their life.
Oh my goodness. Well, you know, having been hit by a drunk driver, I knew the day would come that I would take care of that patient, that I would take care of the drunk driver. And I always wondered how I would respond to that. And sure enough, my first job out of nursing school was at Parkland Hospital in Dallas, an amazing big level 1 trauma teaching center. And I worked in the surgical ICU because I knew at that time that I was, you know, I wanted to see what anesthesia was all about, what critical care was all about. And sure enough, the patients, they came and they went. And for the most part, you know, we saw them at such an acute phase that connection, it just, it wasn't happening for me right away. I was more focused on what I was learning as a critical care nurse. And it took a little bit of time for me to realize that I was still in the position to make connections with people. And I had a patient maybe a year after I graduated nursing school who was young, and he was the passenger. I mean, he was maybe 17 or 18 years old. He was the passenger in a car with his friends who'd been drinking and driving and rolled a truck, and 2 of them didn't survive, and he survived to come to us. And another passenger survived, but I'm not sure what happened to them. But when I saw his mom at the bedside, and when I saw him, and I started taking care of him as much as I could, and really became very emotionally invested in him and his family and their story. They started, you know, a website, and things just weren't going the way that everybody had hoped that they would go for him. And so, you know, to experience that loss with his family, to cry with his family, they started a nonprofit organization afterwards, and a girlfriend of mine and I were involved with the hospital administration, kind of helping them be recognized for that. Really turned my perspective on the fact that you can go into this profession and give it your 100% every single day, and your heart and your soul, and you know, become involved with those patients and the families. But sometimes that, things just aren't meant to be the way that they hope you would be. And so what do you do with those emotions? Where's the meaning? Where's the, what's the reason? Is it, what's the reason? What's the story? And so that was really a turning point for me, that I realized I can't be afraid to give it my all every single encounter with the patient, because you never know what's on the other side. And even though, that was a painful situation for them and a painful situation for me, and even sharing with my family, I would call on my way home from work and cry to my mom about, these patients that I would see who'd been affected by drinking and driving, and kids. I mean, just heartbreaking things. And what does this mean? How, I can't be afraid of these situations or shy away from them. Why am I here? Why is this patient in front of me today? And I feel that to this day. I don't think that there's any coincidences ever in any case that I do, any patient that I've ever had. And it's a challenge and a calling as a nurse to embrace that and understand that, sharing pain is just as important as sharing joy with our patients. And I think that was what that first encounter showed me. And just a few weeks ago, I had a patient who came in because she was suffering a miscarriage, which I have suffered a miscarriage just a few months ago. And it was, I closed the drapes and we hugged and we cried. And that's just what we needed to do. She was a young girl, and sometimes there's no words. And I think, as hard as that experience was for me, maybe God put me in that situation because he knew that, there was somebody else who didn't have the strength that I had or the support that I had to get through it, or, who just needed to know that it happens, to a lot of us. So yeah, nursing is amazing. There's just, these things just happen. So I feel like something like that happens to me every day, honestly.
No, you have such an awesome outlook on life and on nursing. I know you had shared with me in the past that where you work, that you were involved in preparing for your first COVID patient. Tell us a little bit about what that was like and your experience. And if you have a picture to share with us, that would be great too.
Yeah, the preparation for COVID was very nerve-wracking. Thankfully, I live in a rural area, not too far from Seattle, which was hit hard and early. And so the administration at our hospital, the board of directors of my group here were incredible in preparations, unpaid time that they were working above and beyond to help prepare us as a group, which I have friends all over the country, and I don't know anybody who had as cushy a preparation as I did for COVID, for sure. I mean, my sister is a CRNA in Ohio. She's been exposed multiple times, is just in COVID airways all day, every day. My mom in the emergency room, just, so many frontline people across the country have had it so much more difficult than I have. But, preparing for that first patient, it was such a interesting situation, because of course we knew eventually it would come, and our board of directors and administration had hand selected a group of anesthesia providers to be the ones to provide the most acute procedures to these patients, in kind of a one-time sweep deal. And we all kind of wondered when it would happen, and it just makes you think when you kiss your kids at night and I mean, as a lot of things do, but it was a little bit nerve-wracking, but at the same time, I felt like, why would anybody else other than me why should anybody else other than me be in this situation? Have I ever done anything to deserve to be less exposed than anybody else? I haven't. I deserve just as much as, the EMTs who have to walk into these people's houses, and the nurses working without any PPE, who are really and truly the ones, who are making the sacrifices, who can't leave the bedside. When we actually went in to see this patient and intubate and place the central line and the arterial line, the bedside RN was in the room the entire time. And that was the patient's request, that she wanted the nurse to be in the room. And this nurse could have easily been like, when you're intubating, no way. Like, why, that's just silly. But she didn't think twice about it. So
why would a nurse say no way when a patient was being intubated? Is it?
I think, she felt, the patient felt safe with this nurse. She was decompensating very rapidly. The patient, her husband wasn't there. And she had built a rapport with the nurse, who was also a new grad, had just finished school, and who had been clearly was very kind to her, very, very understanding, very supportive of her. And I'm a stranger, my partner and I, who are going in together to get ready to do all these procedures, we're strangers, and we have to work fast. And there's not, in my industry in general, there's usually not a whole lot of time to build rapport and build connections. And the nurse was not required to be in there. That was the whole point of us coming up with this team, to minimize exposure for others in the hospital. And the patient wanted to have her hand held, and the nurse did that for her, which was amazing to see the dedication that she had to her patient. And she'd been working with the patient all day, inside the room all day, in a negative pressure room with the doors closed, and re-wearing PPE. So it was very inspiring to see her do that. And it made what I was doing seem like nothing. I mean, in and out in less than an hour to have everything done. So
what you see is, in your line of expertise as a CRNA, is you see the care and compassion that the bedside nurses provide every day for their patients. And your expertise is that, for lack of a better word, it's a type of clinical technical expertise that's so vital to saving lives as well. And, when you put it in combination of what the bedside clinical nurse does and what your expertise as a nurse anesthetist does, you're really having a huge impact on saving lives together. It's one is giving, hope and prayer, and the other is giving that, I care enough to make sure that you're going to be safe and alive, and do my very best with a different skill set, correct?
Yeah, and that's something that I think about often. And what I like to tell myself and tell others too is that no matter now all of the letters that I have after my name, I am first a nurse. I'm first a nurse. So even though my interview time with the patient might be 5 minutes, I might only have the chance to, ask 3 or 4 pertinent questions before, I have to put someone to sleep to save their life. But I always, when I enter a room, first do the 1 second look over glance that it takes to let the patient know that I'm here for them. And I know many of my CRNA colleagues feel the same way. We have, just that 1 second to make a first impression. And I, you won't see me coming into a room with my head down in a chart, just trying to do things. And then, oh, hey, you're crying on the other side of this or something like that. And many nurse anesthetists across the country, you know, practice in the same way, that we all have been at the bedside. We all have, of course, you know, put the time into, get the advanced education and advanced clinical skills and technical skills, but we all have been at the bedside. And I think, I mean, speaking for the people that I know, and I know that there's a lot of really great CRNAs out there, it's a time that we don't get to have very often with patients, but when we do get to have it, it's so important. It's so important. And we just, you know, have to manage time. Where I used to get a 12-hour shift to make an impression on a patient or a family, now I might get 3 minutes or 10 minutes or, you know, whatever. And it's a skill that we learn just along with, you know, the anesthesia part of it. And like my story from the ICU, it takes time. Of course, there's tunnel vision in the beginning. You don't think about anything other than, you know, getting the tube through the cords. But then eventually, I think we all get to be in an amazing position to still make an impact on patients, even if, you know, most of the time they don't even remember us.
So Melanie, what could you say to young people that, like you were earlier in your life and in before you chose nursing as a career, why should somebody consider nursing? And what traits do you think somebody should sort of inherently have that would make nursing a really good fit for them?
I think, let's see. As a nurse, you have to understand that when you step into this profession, you are given the blessing of stepping into something bigger than yourself. And it's not a day-to-day job. There's days that things are going to be bad and rough, and you'll be tired and covered in somebody else's who knows what. But it's a big picture profession that if you can remember when you wake up in the morning that you have been given the gifts to make something matter for somebody else, then this is what you need to do. You need to become a nurse, and you need to realize that there's so much more meaning in life out there. There's so many perspectives out there. If you want to become a nurse, you don't need to know on day one of nursing school what you want to do. Some people, their entire career, they have different specialties their entire career, working in different places. And the amazing thing about nursing is that there's always a job for you. Any place you want to move, any specialty you want to try, you're not married to it. So if you don't like it, you know, go do something else. I think that if, you know, it takes a lot of ability to kind of self-reflect and having an appreciation for what you find inside of yourself that will make you a good nurse. If it matters to you when you go to bed at night, you know, what impact you might have made on that day, then you should be a nurse, because you're put in those situations all day, every day. And like I said before, they don't always turn out in your favor. They don't always turn out the way that you want to see them turn out, but there's meaning there too. And I believe, you know, God puts us right exactly where we're supposed to be. Nobody's on an island. And if you have it in your heart to leave things better than you found them, which is what I live by every day, then nursing will open those doors for you all day, every day. Sometimes you might not like what you find, but then the cards are in your hands and you have the gift and you have the opportunity to change things for somebody, to be the reason, that someone thinks, they could make it another day, or they can spend another day with their family member, or they can, peacefully say goodbye to their family member or on their own. It's just, you have that chance to step into a world so much bigger than you. And it's not a day-to-day thing, but it's out there. And if you think you're up for it, we're ready for you.
Oh, that's really incredible. I thank you. Is there anything else as a nurse that you'd like to share?
Oh, other than don't drink and drive.
Obviously.
I feel like our talk has been, pulled at a lot of heartstrings for me, but at the end of the day, nursing is so much fun. It's a great career. You make great friends all over the country, all over the world, and you will see things that will blow your mind. You will see people get better. You will see the craziest things happen, and you will get to experience all of the feelings that come with living on this earth as part of the human population. And you will grow, and your mind will just expand, and your heart will just be bigger than you ever thought it could be. Just start. Just go to nursing school. You don't even have to decide. You just, keep your eyes open. Be open to everything. You never know what could happen. You don't know why you were here. Just a few months ago, back in March, one night, my son, he's 1 year old. He was 11 months old at the time. He suffered a seizure and respiratory arrest, which happened to be witnessed by my husband, and I was here immediately available. So of course I go to rescue the airway, and I can't, and have to start doing chest compressions on my own 11-month-old son in the middle of the night, just waiting for the fire truck to get here. And eventually, after 20 or 30 compressions, his lips started to turn pink and he started to garble a little bit. And I thought in that instant, what if my entire life has been for this moment? What if all of the training I've ever done prepared me to know on instinctually, out of habit, exactly what to do in this situation? You just never know. It's just an example of how you never know why God gives you the instruments that he does. But just carry them and see what happens. And
It made me cry.
yeah, I couldn't.
It's just so amazing.
Yeah, there's no coincidences. There's not. And if anybody is watching this and they even have any question about whether or not nursing is for them, it's for you. It's for you. If there's that little piece in your heart, that little seed in your heart, you owe it to yourself to water it and let it grow into whatever it's supposed to grow in. Just come nurse with us. It's right, Pat. It's life. It's amazing.
It really is.
Mm-hmm.
Oh, Melanie, thank you so much. I can't thank you enough for sharing your stories. And
You're so
oh my
welcome.
God, you are just such an amazing young woman. All that you've gone through and persevered, and what you've accomplished. You should be so proud of yourself. And you're just such a kind, God-loving, humble individual. And I'm sure that the people are so fortunate to have you, just care for them and be there with them. Because anesthesia is scary to people. You never know if you're going to wake up, and when you do,
Yeah.
are you going to be the same person you went to before you went to sleep.
Exactly. And, you know, you really and truly put your life in somebody's hands when you're under anesthesia. I mean, we don't go into all of those details when we're going over consent, but I told this to Mrs. Fickley when I started the RNA school, and I first started putting people to sleep, that every single person I have ever put to sleep, I always take a moment right as I'm, you know, finishing my induction, about to intubate them, to make a cross on their head, and just, I take a breath and thank God for, you know, what I've been given, and ask him to watch over my patient, watch over me, watching over the patient, because really that's what we do. We're just, you know, I'll watch over you while you sleep and take care of you. And to this day, I do that, and it's incredibly empowering. And I think a lot of nurse anesthetists and nurse practitioners have, you know, similar, that acknowledge, you know, where we're at in the course of somebody's life. And it's a gift. It's so amazing. I've never by myself, not one step of the way, Pat. I've never, ever been alone. Never. I mean, my support, my angels, even when I was sitting there in the rehab hospital with, you know, 19 years old and sweatpants full of bowel movement that I no longer could help because of my, you know, spinal cord injuries, even then there was someone to help me get through it. I think that, you know, says a lot. And nursing, you can be that person that just tells someone, like, it'll be okay. Things will be okay.